The government is, and we appreciate what the government is doing, that they want universal health coverage, not care, coverage. Yeah, universal. That's what they tell us. I've been asking that question. What exactly is UNHC? Is it universal health care? Is it universal health coverage? Is it universal insurance health coverage? Or if you follow what NHIF said, that they are going to be charging 500 shillings. There was a time they said that. Of course, now they have reduced that amount from every Kenyan 18 years and above by force. And if you don't, they penalize you 20,000. Then that is not universal health care. That is universal health taxation. So is it UHT? That's what we're asking the government to tell us. What is it? Is it universal health care? Is it universal health coverage? Is it universal health insurance coverage? You just cover with insurance, you don't care about the health. Or is it universal health taxation, UHT? Okay? So that when they are implementing, then we know exactly what is being implemented. Because I'll tell you the difference. Universal health coverage. If I have 100 patients out there waiting to come and see me as a doctor, one doctor, on average I take about 30 minutes on every patient. Multiply quickly, 100 patients, that means I'll need at least 3,000 minutes. Equivalent to, divide by 60, 50 hours in a day to finish that queue. So universal health coverage, you don't care. So what do? You enter, you say you have a headache, Panadol. Next, you cover everyone. Now they go home thinking they are treated. Okay? Unfortunately, they go home thinking they are treated. But actually, you saw everyone and treated nobody. Universal health care is where I actually treat 10 of them and spend about 5 hours. Okay? 90 will go to the governor's office and report that I'm not doing my work because they have not been treated, and I will be sacked. That is universal health care. It's a risk to the service provider. But universal health coverage, just like Loliodo, a cup of boiled water, everybody gets the same. Whether you go to die or you don't, but you are all covered universally with a cup of boiled water. That is universal health coverage. Okay? But really what we need, because this is the reason why you have a person with diabetes after some years they go into kidney failure. So eventually we end up with a country with the highest number of kidney failure patients. That is why War Memorial Hospital saw what was happening and bought 10 dialysis machines. And that is why we have the largest number of patients coming to our facility. Now they have been blocked again. So how are we going to achieve this UHC? That's our concern. How do we achieve it if we are killing the private sector? That is investing huge amounts of money, including 2 million to construct a government road. Now you kill that facility. So exactly how are you going to implement this universal health care when everybody is going to the public hospital and you have long queues? Who told you that those doctors will be able to provide quality service? How do they do it? 50 hours when a day has 24 hours. And you're expecting that doctor to work like a machine. No going to sleep, no eating, right? Not even going to the toilet. No. Doctor, continue treating. You're doing very well. The cloud is big out there. Are we going to achieve our target? Okay. We are going to destroy the healthcare system in this country until we start figuring out. Of course, I have those are very nice ideas we have had in terms of go to people who have little knowledge. They start visiting neighbors, whatever. I remember another one who had a similar idea. It was called OLX. You will sell your fridge from home. You know what happened after that? People started getting attacked. People died. Yeah, it you have opened your place for people die. Unless that system is properly organized, my friend, the crisis you are going to face, that you have been given 25 households to take care, basic health needs, Panadol, whatever. The crisis you are going to experience is so big. I don't know how they are going to do it, but I hope they have considered that perspective. That OLX collapsed because of the insecurity. It collapsed. Yeah, 90% was just thugs out there. Uh, calling you, I want to buy your fish, and then they come and take it. So it's not an easy one, but I wish it succeeds. I wish the government the best of luck, but it's not going to be very easy. But there is still that other problem. After they have taken care of that basic health, the Panadol, the headache, now then you destroy the private hospitals. So now everybody goes to the general hospital, the public hospital. Remember, when we spent even by the way, the KRA, Kenya Revenue Authority, has actually given us a commendation. We have, we have been awarded for being the best taxpayer, among the best taxpayers in Nakuru, all right, among the best taxpayers. And that money we pay, that is what is constructing the buildings in the provincial or the county referral hospital, former provincial general hospital. So if you now destroy the goose that lays the golden eggs, so where are you going to get that money to construct? The taxation you get from the government employees, you are actually recycling the money you paid. It is the private sector that where you have a net income. Okay? Now please, special, you know, request special, we are pleading. Let's not destroy the private sector. You will destroy the whole country. That's the reality. Okay. So whatever they had said, yes, we have our position very clear.